Auzu billahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. Assalamu alaikum, everyone. Welcome to AGN Monthly Webinar. Before we jump into the details and discuss the topic, I would request Brother Mustahsan to start this program with Tilawat Quran Pak.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الذي جعل لكم من الشجر الأخضر نارا فإذا أنتم منه توقدون. أوليس الذي خلق السماوات والأرض بقادر على أن يخلق مثلهم؟ بلى وهو الخلاق العليم. إنما أمره إذا أراد شيئا أن يقول له كن فيكون. فسبحان الذي بيده ملكوت كل شيء وإليه ترجعون. صدق الله العلي العظيم.
Ahsant. Thank you very much, Brother Mustahsan, for starting this webinar with such a beautiful recitation of Holy Quran. Arbaeen Global Networking is an initiative of Ahlul Bayt Association. As we know, Arbaeen is not just a religious observance. It is a symbol of unity, compassion, and humanity. It is a time when people from different cultures, backgrounds, and nationalities come together in Karbala to honor the memory of Imam Hussain alayhi salam and his companions. This initiative was launched many years ago to provide a platform to our brothers and sisters and organizations where we can take the spirit of unity, the spirit of Arbaeen throughout the year. And these webinars are a part of the same initiative. The idea of Arbaeen Global Networking is to provide a platform, an online platform where we can connect with each other throughout the year. As a part of this project, we organize annual event in the Haram of Imam Hussain alayhi salam on 21st of Safar every year. And we have introduced online platform arbeenglobal.net to connect our brothers and sisters, professionals, and organizations so that we can sit together, we can work together share ideas, and implement bigger projects. Alhamdulillah, many organizations have joined us over the last few years, and we are organizing these webinars with a theme of Arbaeen. And as we know, millions of people gather during Arbaeen. So it is our responsibility collectively to make sure that we provide all the support. We get unparalleled hospitality. People in Iraq, whether organizers of Husainia, Muakkab, or even our fellow people, Zaireen, they're helping each other. But there are many areas where we can perform much better if we are well aware, if we are trained. For example, cleanliness is one of the things where we have to work together, making sure that during this Arbaeen procession, where Zaireen are walking miles and miles, we make sure we take this responsibility individually and collectively to keep the passage clean and neat. And when we are talking about a gathering of 30, 40 million people, then there's another aspect which we can't ignore. That is the medical challenges. To explore this topic, today we have invited Dr. Syed Mehdi Rizvi to discuss how non-medical community members support medical efforts during Arbaeen. So, Assalamu alaikum, Dr. Mehdi, and thank you very much for sparing your time and coming to this webinar.
Alaikum Assalam. It's an absolute honor to be here sharing this platform, this wonderful platform that you all have created. As you know, I'm coming here today representing an organization that has had the privilege of partnering with your organization, and that is Imam Medics International. I think, what's really interesting is that Imam Medics International, not only were we one of the, if not the first medical camps, in Iraq after the fall of Saddam during Arbaeen, but also that our medical camp, is run very professionally. So we have the so-called typical medical community as well as the non-medical community within our camps. So when I speak in terms of what the non-medical community can do, it is very much not only a part of how we run our medical camps, but also something that we promote externally on how that partnership should be maintained and promoted throughout. So coming back to how Imam Medics was one of the first medical camps, if not, like I said, the first medical camp in Arbaeen, I think we have gained some experience, and so we know a thing or two about the medical challenges during Arbaeen. You mentioned a lot about cleanliness, Brother Misam, and you're absolutely right. I think that touches on a very important aspect, and that is public health.
That's
Now,
right.
you can argue that if you look at however you want to measure the effect, the positive effect of healthcare. Some of you live in UK, some of you who may be watching this live in US. You may have noticed that in those countries, there are major public health efforts. Now, what's interesting is no matter how you gauge the efficacy of healthcare, whether it's to medical innovations, whether it is through the training and education, a very good argument can be made that perhaps the most effective means of impacting the population at the greatest level has been not necessarily through medical innovations or teaching and education, but rather through public health measures. And so I would like to really emphasize the importance of these practices. For example, when we have clean water to drink in the countries that are fortunate enough to have that service, we notice a marked difference in people's health. When we put fluoride in water, we notice people's dental health go up. When we have very strict policies of not smoking in public, we see people's health markedly increase. So all this is to say, Brother Meeson, when you talked about cleanliness, I think, some people may take that and say, what's the big deal? He's not talking about something very sophisticated sounding, like some cardiac, intervention. He's not talking about some like, some fancy drug name. He's not talking about some new research. He's just talking to you about keeping things clean. Is that really a big deal? And as I just said, public health efforts have shown that not only is a big deal, it is perhaps the biggest deal, the biggest way to impact overall community health. So I agree with you. Let's do our part. There's so many things to discuss today, and I'm excited, inshallah, that I hope that we can cover some of those points. But one of those, since you did bring it up, Brother Musa, is cleanliness. Those of you who have had the privilege of staying a day or two after Arbaeen in Karbala, you see the whole scene is a complete, it's sad in many ways. Number one, you miss the crowd that they've gone. It's even though there were all these millions and millions of people were strangers to you, you feel connected to them somehow. And now your family of these 20 million people have just left. So there's a sadness. But also what's really sad is what you see is on the streets, there's garbage. And imagine how that is from the perspective of the hosts, that the people that hosted us, we left them with garbage. And of course, more crucially, during Arbaeen itself, when you're using utilities like bathroom and those streets and beds when you're sleeping in the mokabs, if you don't do basic things like clean up after yourself, you're directly impacting and negatively affecting the next person who will end up using that. So I'll
That's absolutely
pause
right.
right there before we go on. Yes.
Yeah, sure, sure. That's absolutely right. It's everyone's responsibility. So coming back to the topic, can medical or non-medical communities support medical efforts during Arbaeen? So could you start by giving us an overview of the medical challenges faced during Arbaeen?
Sure. Brother Mason, since I'm talking on behalf of Mamiya Medics today, I'll tell you what. The medical camp facilities that we have, it is run in a first class order. We bring the best practices from the West because Imam Hussain deserves nothing else. He deserves the best.
No doubt.
But we are finite in our capability, meaning finite in the beds that we have, finite in the physicians that we have, finite in the resources that we have. And so I would really ask the non-medical community to do their part in trying their best to keep themselves and others healthy. Why? Because even though the medical community is here to serve, let's make it so that when you get sick, it is after you have done everything possible to not get sick. And of course, no one can, guarantee you not getting sick. And as us as a medical community, when someone walks in through a medical camp, we don't judge why you got sick or why you're here. We treat. But remember, every time you take up that bed, it means somebody is not getting that bed. Every time you take up that physician's time, it means another Zaire is not getting that time, and so on and so forth. So what this really is a request to the non-medical community at large that during Arbaeen, I know that people are passionate. I know that, your emotions are at your height. I know you really want to, you know, feel the ziyarat. And I respect that as a fellow Zayir myself. I respect that. But in your passions, in your pursuit of fulfilling this right of the Imam, remember to fulfill the right of your fellow Zayir as well. Make sure that you're taking care of yourself. Make sure you're not getting sick because of something that you could have easily prevented yourself from getting sick. It's not, I would argue it's not the most honorable thing. If you know, of course, if you don't know, that's different. But if you know you need your diabetes medications, it's not good to say we leave it up to Allah and come here, because when you do that, you will end up having to take up a bed that somebody else could have used. So, in short, do your part. If there's a medication list that you take, medications, bring your medications. In case your medications get lost, make sure you have a picture of that in your phone. Make sure you do your part. Simple things go a long way. With so many times you will see patients coming in, they will have, diagnosed conditions, but we don't know what other medications they have. We don't know what their history is. We will have to do investigative work ourselves. If you can do this, you can really help us out. And it's all about taking up time, taking up resources, taking effort. We are here to serve, but this should be as a resort that you did everything in your power. You were responsible and you still got sick, which is totally understandable. You did everything possible. You still lost your medications. You still lost. Of course, then we're here to serve. But let's do that part. Number one, if somebody's taking medications, let's go through a list. Number one, if somebody's taking medications, make sure you keep those medications in a secure place, such as your carry-on, so you don't lose in your luggage. If you are taking medications, also make sure you take a picture on your phone so you can bring the list in case it gets lost. Number two, if you know you're prone to getting some pain, if you know you don't have any allergic, reactions or any nice negative side effects to some painkillers that you know that you could take safely, bring those. Again, if you come to the medical camp needing a simple acetaminophen or ibuprofen, we are more than happy to serve, of course. But let's do our part so that, remember, every time you take up a bed, it means somebody else is not getting that bed every time you take up a resource. Number three, hydration. So many cases of dehydration, Brother Meeson, we saw. We all knew it was going to be very, very hot. And I know that regardless of how much we try, there will still be some people who will, of course, get dehydrated, who will, of course, get heat exhaustion and heat stroke. But let's do our part. Let's do what we can to make sure we are hydrating. I know, like I said, the passions are high and you're thinking of Imam Hussain and his thirst. But remember, if you end up in a condition that needs that bed, again, you're taking up somebody else's bed who could be more critically ill. So let's make sure that we are drinking as often as we can. You talked about cleanliness, and I know it's a big challenge. Sometimes when you have 20 million people, despite the best efforts by the people who host us and the toilets, sometimes they're not in the standards that we in the Western world are privileged. Sometimes we get spoiled. Sometimes it's not always in the best sanitary standards. And so what ends up happening? People end up drinking less so they can avoid using bathrooms. Especially, unfortunately, we see these cases in women because they have to wear, garment that is a bit difficult to maneuver in the bathroom. So they say, you know what? I'm just not going to drink as much water. I'm going to try and tough it out. And what ends up happening is that they get dehydrated, they get heat exhausted. My plea to you is please, 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 please try and make sure you resist that urge of avoiding bathrooms if it means that, you're going to get dehydrated. Try to drink as much water as you can. It is not worth it just to avoid that discomfort for you to get eventually heat exhaustion and end up in a bed. So number one, with the medications we talked about. Number two, we talked about simple pain medications you can have. Number three, we talked about dehydration. And number four, if you can take a first aid class anywhere in your local community, take it. Imam Medics has several offerings. We're very active. We have a chapter in almost every country you can imagine. We are active in almost every continent you can imagine. We are still trying to open up a chapter in Antarctica, Brother Misam. Inshallah,
That's
maybe
great.
someday
That's
we'll be
great.
successful.
Yeah, I just come to my next question. So, of course,
Yes.
it is crucial that as a person we take care of our health. We go there prepared. So, firstly, we don't get sick ourselves. And now we are talking about how we can help other people because obviously, such a big number, there would be sick people, there would be people who would need support. So, my next question is how non-medical volunteers can assist medical professionals during Arbaeen?
That's a great question. I think the first and foremost, the most important thing is to learn if you're going to help the medical volunteers, learn what is considered evidence-based medicine. In everything, we have evidence base. In our Islamic creed, we have, proper jurisprudence. We don't just think, I think this is the way to do things. No, there's a proper science to it. Similarly, when it comes to medicine, while we respect, all the other fields of medicine, what we really want to focus on is evidence-based medicine. So therefore, my plea is the non-medical community, take some simple courses that are based on evidence-based medicine, such as first aid, that's based on evidence base. There in the US, if you're there, there's some amazing courses by Stop the Bleed organization. That is how to stop deadly bleeding. And, as a non person with a non-medical background, you can really take advantage of that course. So God forbid if something does happen, like an accident and someone is bleeding out, you can easily respond. There are many courses available by Imami Medics, by other organizations in your local communities. Just come prepared. Take a course or two, get a few gears, and you can come there for and have a few items in your bag yourself so you can hand out. Simple thing, you can really save a life using proper tourniquets, that is cat tourniquets for bleeding, for example. And if you take a course like Stop the Bleed, it can help you out. Or if you're lucky enough to come for Arbaeen, Imam Medics International actually gives those courses as well. So come to our camp, inquire about those courses, and we will teach you some of those very critical life-saving techniques so you can go and help your other fellow Zairine.
Amazing. Definitely. So we all get prepared spiritually when we're even making intention to go to the ziyarat of Imam Hussain alayhi salam. But thinking from this perspective, I think it would increase our sawab because at the end of the day, we will get the sawab of ziyarah, is countless sawab. But just imagine that we are there. Along with that swab, we are helping Zaireen, especially those people who get sick. And if we get this training, whether it is related to first aid or the other programs you mentioned, I think this would multiply our swab, our reward. And our intention would be so pure that we would get more and more swab. And Imam Hussain Islam would be so pleased that we are preparing ourselves not to just do ziyarat, but also to help other mu'minin during those days. So if I talk about the most common medical emergencies, I'm talking about the emergencies. So what are the common emergencies? What type of challenges people, as Irene, faced specifically during Arbaeen?
Yeah. So it depends on year to year which season we're talking about. During Arbaeen, if let's step back and I'll say the most common condition is usually respiratory illnesses,
Mhm.
some sniffles, some runny nose and whatnot. And then it's GI issues, tummy issues. The emergencies where, somebody really needs that bed is oftentimes, again, heat exhaustion and dehydration. Or somebody forgetting their medication. Again, people who maybe have diabetes, they may have forgotten their insulin. There's some very, very basic and oftentimes preventable conditions, that again, we could really take care of so that we can give attention to some of the other emergencies. Speaking of, respiratory illnesses, again, these are simple, things you can have in your bag, some nasal decongestions, some saline, sprays, saline, it can really help you take care of yourself, so that you're not having to rely on the medical camps. Again, I'm not at all saying don't come to medical camp. We're there to serve. That's what we're there for. All I'm saying is just remember to do your part so that when you're coming in, it's because you have to. You can bring in ORS, oral rehydration salts, from the West. They're amazing when you're dehydrated. You can use them with water to make sure that all your salt electrolytes are properly in your system. So again, you don't get that level of dehydration. So, like you said, part of, intention and niyat is going there, spiritually getting ready. And a part of that spiritual journey, you cannot connect with Allah without connecting with your fellow people. And a part of the connecting with your fellow people is caring for your fellow people. And believe it or not, you caring for yourself, it's like you're caring for your fellow person. Because if you are caring for yourself, it means you're keeping yourself away from being sick and you're being healthy and you can serve and help others. Inshallah.
Inshallah, inshallah. So, being a non-medical individual, how can I contribute maybe towards setting up or maintenance of medical camps? Because we know medical people, paramedics, they're all super busy. But if I'm going there as a Zaire and I would like to volunteer, so what are the things that I can do as a non-medical person?
Yeah, that's a great question, Brother Mason. One thing I've seen, Brother Mason, you'll be surprised by, and this is truly the barakah of Imam Hussain. I've spent, so many years in my professional life, and you know what's interesting? The medical camps that are run during Arbaeen, a lot of them are volunteer. And even though they're volunteer, they're some of the most professionally run medical camps. If you were to see, any other organization in the world that is paid and you see the volunteer medical camps, you will not be able to notice the difference. In fact, you would think that the volunteer camps are run as if they're being paid. Now, the
MashaAllah.
reason I'm saying this is because they're run very professionally. They usually have, especially for example, in Mamiya Medics, we have things planned out months in advance. So the question is, are we in need of volunteers? Absolutely. Not only us, every medical, and I can speak for all the other medical camps, they're all in need for medical volunteers, non-medical volunteers to help them out. But because the camps are almost always run very professionally, the planning begins beforehand. There's usually always a registration process, orientation process, training process, and then they come and help out with the medical camps. So my suggestion would be find out which medical camps are active in your community. If you know somebody in your local Hussainiya, if you know somebody in your local masjid or a community that is part of a medical camp, find out from them. If you're not somebody who's a clinician, don't be afraid. We need non-clinicians. There's, like I said, at Imamiya Medics, my whole conversation started off with this, that there's a big component of our staff that I would honestly, quite frankly, call the heroes of our medical camp, the administrative staff. They're absolutely fantastic. And our medical camp success will be absolutely impossible without them. And so, but the way they come and become part of this medical camp family is they go through the same process as the doctors, which is everybody signs up beforehand. They find out about medical camp, find out, they register, they go through the selection process, orientation and registration, so on and so forth. So please, please, please find out which medical camp, if you know somebody in your area who's part of a medical camp and they're active, and reach out to them today. Please reach out to them and tell them today, I would love to be part of your team. I'm not a doctor, I'm not a nurse, but I would love to help out. And I am almost certain that they would say, welcome, and they are going to include you in their process.
Great. I think that's a brilliant advice. So it doesn't happen on the day. So as you said, so the planning starts months and months in advance, and we're not too far. So nearly less than probably 6 months to this year's Arbaeen. Um, we are living in the world of AI now. Are there any digital tools or apps that can help in coordinating medical efforts, or any tools, apps you can suggest that where we can learn about, dealing with such situations, or um, general advice basically. This is for non-medical volunteers or individuals who are going there.
Yeah. Oh, wow. That's a great question. You know, one thing I would say is that remember, AI is a tool that is there as to assist you. So the reason I'm saying that is AI will search the web, whether we're talking about Chat GPT or DeepSeek now, they will search the web and they will do their best to give you information based on what they search. There's a rule in data science. I'm sure some of you who are into data science have heard this rule. Junk in, junk out. So what that means is as it's searching the web and scrubbing the web and formulating, the best answer to give you, I'm sure it will take a lot of accurate information, but there could be some junk information as well, and it's going to give you that answer. Be very careful because that, even it gives you, let's say, seven very good piece of information, the two incorrect information could be very destructive. Now, why is that important? Because as we're coming upon the age of AI and dawn of I would say for now, when it comes to very critical aspects, some very, very important, information that you need to seek, that you absolutely need it to be 100% accurate, go to trusted websites. So go to your, whether it is trusted medical institutions, your government agencies, go there for now until we get to a point that we can really start trusting AI a bit more. And like you said, Brother Misim, you know, if we know that it's going to be hot in Arbaeen, if we know that we're going to one of the hottest places on earth during one of the hottest times on earth, then we know that, okay, I probably am going to suffer from dehydration. I'm probably at risk from suffering from heat exhaustion. So even a simple Google search, even when you're waiting on the plane before it takes off, go to your government agency, go to CDC, go to Johns Hopkins, University of Maryland Medical Center, or anywhere else that you feel is very trusted website, NIH for you UK folks. Look up, what can I do for dehydration? What can I do for heat exhaustion? Those simple guidelines that it gives you could make a difference between you staying out of the bed that could have been used for somebody else who's more critical.
Wonderful. We have talked about hygiene, we have talked about preventive health measures, which are critical, and then we talked about how volunteers can help, even non-medical volunteers can help a lot. Are there cultural or language barriers in medical sport, and how volunteers can help bridge these gaps?
Oh, very good question. In our medical camp, when I'm talking about the administrative team, we always are hungry for people who speak Farsi. We're always
Mhm.
hungry for people who speak Arabic. It's just so happened that, most because it's because the population. It's just simply because the population factors that a lot of the Muslim Shia community, specifically in the US, that's very active, happens to be from the Indo-Pak region. And because we are living in the US, for example, or UK, we are more privileged. So, like the saying goes, they're the ones who have more are have to, they're answerable and there's more burden that they have to give more. So a lot of the medical camps, let's say, are from those countries. Well, if most of them are Indo-Pak, you can assume that they don't have very good Arabic speaking skills. And let's say you do find a community, you find local volunteers and you got good Arabic speaking skills. Farsi tends to be a big demand. So all of you listening, if you are Farsi speaker, please reach out to your medical camp community. I can almost guarantee you that there's going to be a affirmative action and you're already going to be in part of it. I know there are countries that are trying to get rid of DEI measures. Well, guess what? For medical camps in Arbaeen, if you're a Farsi speaker, consider yourself DEI accepted immediately. We need people with those skills.
Yes, this is, I think, really, really important because we have experienced this at our mock-up. Alhamdulillah, we managed to serve at a couple of mock-ups in the last 2 years. We had people who could speak Persian, Arabic, Punjabi, Urdu, Hindi, English.
SubhanAllah.
So a lot of people were coming with their queries. My next question is actually related to mock-ups. So how Arbaeen mock-ups can help in getting ready or prepared for any sort of medical emergencies? Because there are so many mock-ups, tens of thousands of mock-ups, I would say. But how can these mock-ups, they're offering a lot of services. So how can they help in getting ready for any medical emergency?
That's a very good question, Brother Misam. And you just asked a question that, so let me start with this. In the mock-ups, I'm sure you've also noticed this, Brother Misam, they're tiers, and let's be candid. Just like in hospitals in the
Yeah.
US or everywhere, there's level one trauma, level two trauma. They're like tiers in the mock-ups as well. So I would say the tier one mock-ups, the one that are best equipped, the ones that have a proper triage system where you have to see, when you have to go through a registration process, you see a junior doctor, you see a senior doctor who signs off on your diagnosis and prescription. There's a proper pharmacy where you go and you hand in your prescription from the doctor you got to a pharmacy like Imam Medics does it, where there's a proper where these are, I would say, the tier one mock-ups. This is something that all the tier one mock-ups are striving towards, is to make sure that they're ready to handle major emergencies that, God forbid, if there is a stampede or if there's a bomb blast with how the world is going these days, that we are ready for that. I wish I could say that all the mock-ups are ready with that capability. They're not, but of course, then the burden is more on the tier one mock-ups. And there is more of I would say, a incentive and pressure and, responsibility on these mock-ups to make sure that we are doing everything at the highest professional level. We are making sure that our triage system, our patient flow is very efficient because we don't know what, if any time, we would get a large surge of patients that will require very high level of care. The way Imami Medics has done it, again, like I said, when you come into our medical camps, there are arrows telling you where to go. There's a very strict registration process. There's a queue. So the front of the entrance is always open in case there are people, and they do, or volunteers do come in with patients on stretchers, so there's always an opening. We have every shift very experienced physicians who are emergency medicine capable, at least. And And we have physicians also, we have orthopedic doctors, we have very high specialists, and we have those all the time in every single shift. And they're all supported by very experienced nurses. And those nurses are in turn supported by very experienced pharmacists who are supported by very experienced administrators. Because our motto is always make sure that you over prepare. And that, I think, in conclusion, can answer your question, Brother Misam. What can mockups do? My advice would be whatever that you think you're striving for, make sure you're over prepared.
Right.
Because if the situation demands it, you would be thankful that you're over prepared. But if you were not, then you would be sorry.
Yeah, that's right. So I'm coming to final questions. Um, my next question is obviously there is a lot of coordination, and we see so many pharmacies and medical camps on the route from Najaf to Karbala and on other routes of Mashi as well within Karbala. So, what steps we can take to ensure better coordination between NGOs, medical teams, and local authorities?
That's a great question. I think one thing we can do to and the systems in the local area, they are working towards that. They are trying to implement higher standards when it comes to how prescription drugs are handed out. They're trying to do a lot. They're trying to put in regulations so that things are done in a more responsible way. I think, it's more of a question of how are medical camps functioning with each other. I would say that there is a very good relationship, for example, Imamiya Medics International and Ataba Hussainiya. That's just a good example. We work hand in glove with Ataba Hussainiya. And the reason we do that is because we know that they are a very professional organization. They are one of the most, um, rooted and one of the most trusted organizations in the area. So it makes sense for Imamia, which is also a very trusted organization and a very professional organization, to work in coordination with them. So I would say that the best way for mock-ups to coordinate is to find another mock-up that aligns with your values and your capabilities and partner with them, because this relationship that we have is synergy. It is the impact of this relationship is obviously much more than if you were working individually. And so, it's not just Imami Medics, and Ataba Hussaini, of course, partners with other, institutions, and not just the institutions like Ataba Hussaini or other medical camps, Brother Misan. What's interesting is the medical camps, oftentimes we also partner with other hospitals, because ultimately the patient has to go to the hospital. So as the medical camps are looking to form partnerships with other institutions and with other medical camps, of course, it's very important for medical camps to also form partnerships with other hospitals, because sooner or later, if a case demands it, they will need that relationship to be able to
Great,
transfer the patient.
great. My final question is how platforms like AGN, Arbaeen Global Networking, help facilitate better coordination between volunteers and medical teams? Or if I simplify it, how we as Asian platform can help IMI to offer the services in a better way or to get more volunteers.
Brother Misa, I would say you're doing exactly that right now, and that is bringing awareness. I think Arbaeen Global Network has done a fantastic job in increasing awareness of the organizations that are doing Imam's work. And I wish you all the best, and I would say please continue doing this, because despite our best efforts, I'm sure that there are people who may not have heard of Imamiya Medics International, or may not even heard of the fact that that there is possibility of medical camps in my local community that I can join. I did not know that. And because of you, I'm guarantee you there's somebody sitting right now in their living room thinking, wow, I never knew that I could join a medical camp, but I never knew that I had to do it earlier, or I'm sure there's some Irani, youth out there who really wants
Mm.
to volunteer, who's thinking, oh man, I'm not a full-blown doctor. I'm just an EMT training. I don't know how I could serve. And now they're thinking, oh, I didn't know that I would be treated as a VIP if I joined a medical camp. you know? And all this is because of your platform that is bringing awareness to this. And so thank you for, doing this incredible work. We as Imamiya medics, we try to advertise, we try our best to get the word out there, but at the end of the day, we're not an advertising agency because we only have finite amount of resources. We're 99.99% volunteer run. So with that said, most of our effort is on patient care and bringing, impactful, positive impacts at the ground roots level. So with that, we need help getting the word out. And so your work right now, this program and this platform has been absolutely critical. So thank you and appreciate everything you folks are doing. May Allah, through the tawassul of the Ahlul Bayt, grant you all the success on behalf of not just myself, but your partner organizations such as Imamiya Medics International.
I mean, and thank you very much. And once again, on behalf of the entire team of Arbaeen Global Networking, we are thankful to your presence, to the valuable time and advice you have given. And at the end of this session, I would request everyone who is listening and who is going to Arbaeen, if you would like to volunteer for the medical teams, camps, or is there any other area of expertise, please reach us. We have online platform arbaeenglobal.net. You can follow us on social media. We do have WhatsApp community groups as well. We are looking for volunteers. The whole concept of Arbaeen Global Networking is to connect organizations. Just imagine that we are providing a networking between medical teams. So if you're a medical person, if you're a non-medical person, you would like to volunteer or help your fellow Zaireen, please stay in touch. Join our platform where you can connect with other like-minded individuals. You can connect with other organizations. So hopefully in the next few years, we'll start seeing the benefits of this networking where organizations, they're working together with more collaboration, more coordination, and serving the Zaireen and Ummah generally in a better way, inshallah. With that, thank you very much, everyone. Thank you, Brother Mustahsan, and everyone who was with us during the webinar.